Welcome to Hello Malaysia. I am your host Sureti Sanusi, and today we're talking about tuberculosis. Now I know, or is better known as TB, but I know that some of you could have heard of it but do not really know what is it all about. And today in the studio we have Dato Dr. Abdul Razak Abdul Muttalif, the senior consultant chest physician from Institute Respiratory Medicine. And we also have a patient of TB, Mr. Melvino Ricardo Stanley Gomez. Did I say it correctly?
Correct.
Right. Thank you to both of you to be with us
Thank you.
speak on TB.
Thank you.
Right, but before we talk about TB, let's get to know both of you a little bit. We start with Doctor. You told us that you're originally from Penang.
Yeah, I'm from Penang, Sureti. I'm from Penang, born in Penang and grew up in Penang. But my career took me all over Malaysia.
Okay.
Okay.
So you've been all over places.
All over the places,
right.
and I was covering from Perlis to Sabah, Sarawak at one time. Because at one time there were not many chest specialists in Malaysia.
Okay.
So there was no chest specialist in Sabah and Sarawak at all. So we used to cover there once a month.
Okay. So you always been honing on tuberculosis, or were you doing?
Again, once I must understand that Malaysia again is a new country. You can say it's a very young country.
Okay.
So we don't have much specialists in Malaysia.
Right.
So in any specialty, we have only quite a small number. For lungs, we have a small number of specialists. Similarly, for heart and for gastrology and everything, they got small numbers, but we are growing up.
Yes.
So in Malaysia, you can say right now we got about 120 lung specialists.
Okay.
All over Malaysia.
Right.
So when I actually first started about 30 years ago, there were only very few lung specialists. So we treat every disease.
Okay.
Not only TB.
Right.
We treat from pneumonia, from smoker's disease, from lung cancer, from TB, anything to do with lung disease.
It's
under us.
Okay.
But now the younger guys are very good.
Okay.
The young guys are getting much more specialized in the sense that they will say that, okay, I'm a lung specialist, I will treat only lung cancer.
I see. Right, that's very specialized.
Very specialized.
Right.
Then they will say, okay, I'm a lung specialist, I'll just treat only asthma. Or there's a thing called sleep disorder.
Okay.
Some people always snore, they can't sleep very well, they get choking and everything.
Okay.
So they become sleep disorder specialists.
Oh, okay.
But they are lung specialists.
Okay, but it's
they
under
treat everything,
sleep
but it's
order.
special in something smaller.
It's
something
very
more
niche.
Very
Yeah?
niche character.
Okay.
So we're going towards that.
Okay.
So if you ask me, Malaysia is doing quite well over the past 10 years.
Right.
We're
Developing
as character.
Right. Okay. And Stanley, I know you're originally from Terengganu, right? And you moved here in KL.
Yes, Klang.
Right, with your family?
With my family in 1989.
Right. And before we go to Stanley, and we asked, because he is a patient of tuberculosis, but before we go and ask Stanley, his experience on having tuberculosis, let's talk about what tuberculosis all about. Yes.
So it is very interesting. Tuberculosis, many people got a lot of funny thing about tuberculosis. No? And I always tell people that tuberculosis is just one cause for it.
Okay. Which
is?
It's
a germ.
I see.
It's a TB germ.
Right.
We call it Mycobacterium tuberculosis.
Okay.
It's not due to cigarette, it's not due to pollution, not due to food, not due to drinks.
Okay.
It's just a germ.
So that's all myth.
That's all myth.
Okay.
The only thing is that these germs, they fly in the air.
Okay.
So it's what they call airborne.
Right.
Airborne means it is found in the air. They are floating in the air sometimes for hours and for days.
Right.
Suppose there's someone with TB and the guy coughs. So his phlegm actually will be on the floor.
Okay.
And then they will actually evaporate. So when they evaporate, they become small particles.
Okay.
They come under microns in size. And these microns in size will just float in the air. And you happen to be there.
Right.
So you may just get it when you breathe in.
Right. So that means everyone is at risk of having TB?
Exactly. But the trouble is, again, your body system is fantastic.
Which is?
If you just breathe in, say, a small amount of Mycobacterium tuberculosis, your body can fight with the germs.
Okay.
That's very good. But if you expose the person every day for hours, and then you get loads and loads of this bacilli in your lungs, then your body can't fight with the infection.
Right.
You get a disease.
Okay. So usually, in Malay, they would say batuk kering.
Exactly. If you ask me, that's a very good word,
Okay.
Because whenever they say batuk kering, because the thing is, whenever these people, when they cough initially, the cough is more of a dry cough. And now they put TB. So TB is not linked to batuk kering.
Batuk kering.
When Malay people say batuk kering, it's a cough.
It's TB.
It's TB.
Okay.
And I always say it's a good one not to take it away at the moment, because the most common symptom for TB is cough.
Right.
Everybody got TB will cough.
Right. Would there be anything else?
Like what do you mean?
Any other symptoms that besides the coughing?
Oh, correct. The thing is, the cough is the main symptom.
Okay.
I must also tell you something in the sense that the TB affects the lungs 90% of the times.
90% of the times. Okay.
But 10% they go anywhere in the body.
Right.
They go to your brain, your kidney, your bones, your spine, everything, in your heart, everything. But the 90% of people who got TB in the lungs, they always present with cough one.
Will go to the
and
lungs.
the other thing is they will present with loss of weight.
Okay.
They become thin.
Right.
They lose appetite.
Okay.
And the other thing, they will have a night fever or night sweat.
So every night they would have this kind of sweat.
Sweat.
Right.
And then they may sometimes cough out blood.
Okay.
These are the main symptoms they actually have for TB.
Right. But usually it will start with coughing?
Most common is coughing.
Okay.
And that's why people miss.
Right.
And they say that ini cough, ini batuk biasa ni.
Right. Especially if they smoke.
They smoke, they say it's called smoker's cough and everything. So they miss it.
So they might misdiagnose that between batuk. And you mentioned that part of the myth is that if you're a smoker, you are prone to have TB.
Actually, in a way, it is true and not true.
Really?
Because, like I said, TB is caused by germs.
Yes.
Correct. So, TB germs will cause damage to your lungs. But people who smoke, the lungs are damaged.
Okay, already damaged.
Already damaged.
Okay.
So, the lungs cannot fight the infections.
I see.
So, they are prone to get TB.
They have a higher risk.
High risk character. So, although the smoking doesn't cause TB, they got risk factor to get TB higher compared to non-smoker.
Right.
No?
Are you? I'm sorry, but Stanley, are you a smoker?
Before, yes.
Right. So when you had your symptoms, were you thinking that you were only coughing because of your smoking habit, or probably you think you were having something else when you first started?
At the beginning, I first started, I thought it was because of smoking.
I see.
But I ignored it.
Right.
I ignored it until I met Dato and the doctor and his staff. He told me it's because, like what Dato said, it's when you smoke and you drink, your lungs become weak.
Damaged.
Damaged, weak. You know.
Okay.
I mean, then you get the bacteria. It's not capable to fight it. You know.
Okay.
So he advised me to take the medication.
How long were you coughing before you went to see a doctor and discovered that you have tuberculosis?
Actually, 2011, I was coughing but not so serious, but I was coughing every morning.
Right.
Every morning I
get up.
How
bad was the coughing?
Not so bad, but I cough till vomit. Sometimes I vomit.
I see. Do you cough blood as well?
No.
Okay, no
blood.
The
blood happened in 2013.
Okay. What
December.
Happened? What happened?
I went to take my shower. After I brushed my teeth, I coughed in the bathroom. You know?
Right.
And then I spat my phlegm.
Right.
It was blood.
Right. But do you know back then you already have tuberculosis?
No.
This was discovered when?
December 2013.
So you were coughing since 2011, and you only discovered that you have tuberculosis 2013.
Yes.
Is that late, doctor?
Yeah, you can say it is late in the sense that sometimes, like you say just not correctly, sometimes people cough very often.
Right.
They think it's just a normal cough.
Right.
You know?
Especially if they smoke.
Yeah, if they smoke. So and the other good thing, sorry, I want to tell you about what Sandy mentioned about this coughing out blood. I'm sorry if I sound a bit sensitive,
Okay.
Many Malays, they still have this myth that coughing out blood is santau.
Okay.
And it's very sad.
Right.
I must tell you, I feel very sad because this santau thing, although it is true in a way, it's true because we have to believe in benda-benda halus.
Spiritual.
Yeah, we have to believe. As a Muslim, even the Prophet actually was actually like this thing, if you believe me.
Yes.
But probably whenever they cough out blood, they always think of santau first.
Okay.
And they don't come and see us.
So the first thing they do is they seek the alternative ways.
Medicine. Yeah. When you go into alternate medicine, they also say that's santau. When they say somebody says santau, you feel very happy because I know what is santau.
Yes. The reason
because
why you're coughing out blood.
You already confirm your diagnosis.
Right.
So they take delay in getting this sort of thing, and so by the time they come and see us when they become very ill, and I really feel very sad.
Okay.
And I've been working in the past 30 years as a lung specialist. I've seen many young people die because of TB.
Right, and you mentioned that having TB doesn't mean that you have to die.
TB is 100% curable.
Okay.
Nobody should die of TB.
Right.
And last year, if I can tell you, last year 1,600 people died of TB in Malaysia.
Really? Is that a high number?
Very high number.
Really?
I mean, 1,600 person dying of TB is something which should be really alarmed in the sense that they should not die.
Okay, they should
not die.
Right.
If they die, it's probably because they come in late.
Okay.
Or maybe they diagnosed late.
Right.
Or maybe they have something else. The other thing why the people die because they've got the other bad infection called HIV.
Ah, okay.
So, HIV and TB are very close friends.
Really?
Very close
because
friends.
of your
the
low
immune system goes
system.
down.
Yeah.
No?
So because of that.
Yeah, correct. True.
Now let's talk about, because you are also the Deputy President of the Malaysian Association for the Prevention of Tuberculosis.
Correct. We call it MEP-TB.
And what is the association all about?
So the thing is very interesting, Surati. MEP-TB was one of the first NGO in the country for any infection.
Oh, okay.
Yes.
Right.
It started in 1950s. You know? Even before the government actually took an initiative for TB control program, the MEP-TB actually started the TB control program in the country. And they played an important role as an NGO.
Okay.
Even in the 50s.
Right.
And I remember very well that this MEP-TB initiated lots of patient care.
Okay.
They go to patient's house, they give them treatment, they go to patient's house, they give them counseling. They even go to patient's house for what they call monitoring TB treatment.
Okay.
And some of the states like in Penang, I was in Terengganu for 10 years, they even donated wards for TB.
Really?
Yes, correct.
Okay.
So they used to be very active in the TB control program.
Okay.
And only until 1961, the government of Malaysia started the Pusat TB Negara. That's where I work now.
Okay.
So that Pusat TB Negara is changed to the Institute of Respiratory Perubatan.
I see.
It's a different name, that's all. But it's the same center.
Right.
So this MEP-TB, again, the TB Society, is one and the only NGO for TB in the country.
I see. Okay. And what the services that you provide?
Correct. The MEP-TB, actually, we have a federal, sort of a central kind of headquarters for MEP-TB. And every state will have a MEP-TB sub-branch.
Right.
So in every state, there will be someone doing the activity done by the federal level for TB education. Basically, we do a few activities.
Right.
The first thing is we call educating people about TB.
Okay.
We give some seminars and some talks in the schools, in the factories, and working place. That's one. The other activity we do is that we call it treatment allowance scheme.
Treatment?
TAS.
Right.
Treatment allowance scheme.
Allowance scheme.
Allowance, yes,
which
correct.
means?
Which means a lot of patients with TB, they are poor.
Okay.
They are poor. They do not go to work. They can't go to work because TB is very bad.
Okay.
So this society gives them an allowance every month.
Okay.
To subsidize their traveling or food or whatever it is.
Okay. And I know that the association, I think it's at Jalan Pahang?
Jalan Seputra.
Oh, Syed Putra. Okay.
The main headquarters is in Jalan Seputra.
I see.
The one in Jalan Pahang is they got the X-ray service.
I see.
It is started by MEP-TB. Another good initiative.
Right.
Where again, this MEP-TB actually got the X-ray machine over there. So patients can actually go there for X-rays. Some people go there for medical exam for X-ray and everything.
I see.
So they got two things over there. One is they do a service for X-ray and there's an income there for them to give the patient the money in the future.
I see. So talking about X-rays, doctor had brought in a few X-ray slides to show us how TB would affect the lungs.
Definitely,
but we'll see all those after we go for a short break. So stay tuned.
My precious little Nita, why did you leave me? How hard I try, my pain does not go away.
Papa! Papa!
My child has become a victim because of me.
Nita!
Pakcik, boleh saya tolong?
We cannot change the past,
But we can protect our future if we act now.
Longkah batasan masa, mengupas isu semasa, jadi saluran pelbagai suara, segalanya baru dan benar di Berita Bernama TV.
Current issues, latest headlines, illuminating visuals. Everything right and now on Bernama News.
And welcome back to Hello Malaysia with me and Datuk Dr. Abdul Razak and also Stanley, a patient of tuberculosis. And of course, we're talking about tuberculosis. And before we went for a break, Doctor was talking about us, the places, the association where it's situated and the services that you provide. And now let's talk about, let's see what TB affects, how TB affects the lungs, and Doctor has brought in some what do you call that, slides or X-rays?
We call it X-rays.
X-rays to for us to learn and to know what is it all about. And we have Stanley's fortunately here.
True. Before that, can I just tell you something, Surati?
Right.
To diagnose TB, suppose you got a cough.
Okay.
You see a doctor in the private clinic.
Okay.
And then the doctor cannot diagnose TB with a stethoscope.
Okay.
That's very important, no?
Right.
Because when you have TB, which is very early, your stethoscope is useless.
You can only hear phlegm, right?
You can't hear anything.
Really?
Because when the TB is very early, your lungs are not damaged yet.
Okay.
When the lungs are not damaged yet, the stethoscope will not detect any abnormal sounds.
Okay.
They can only detect abnormal sounds when the lungs are damaged.
But how would you know? How, I mean, if I'm at the early stage of having TB,
correct. The question
I would not know whether I'm having a TB or just
question.
a normal cough.
If you are coughing for more than 2 weeks,
okay,
and if you have all the symptoms, like I say, you lose weight, lose appetite, everything,
right,
the best thing to confirm TB is check the phlegm.
Okay, what's wrong with the phlegm?
They will do a microscopy. They check the sputum for the TB germs.
I see.
That is one way you can say for 100% whether it's TB or not TB.
And that is that's only available at the hospital, or can I do it at any clinic?
Most of the time, most government hospitals will have a microscope.
Okay.
And some private hospitals will have a microscope.
Okay.
But clinics rarely have microscope. Almost none.
Right.
But the government clinics at time almost all have microscope.
So when you have 2 weeks of coughing, just go to the hospital and start.
At least get an X-ray done.
Okay.
X-ray will give you a clue.
All right. A bigger picture.
I can show you an X-ray.
Okay.
Okay. Can I just? I'm sorry. I'm going to teach you about X-ray.
Okay. Never mind. It's okay. I'm not really sure. I'm not a doctor anyway. So.
Okay. Anything black is normal.
Anything black is normal.
So
okay.
your lungs are black.
Okay.
Black because there is air inside the lungs.
Okay.
So radiation cannot actually be absorbed by the lungs. They become black.
Okay.
Anything you see white here is the lung, is the heart.
Okay.
The heart has got the muscles and got the blood.
Okay.
So they are white.
Right.
If there's air, they become black. If there's any tissue, they become white.
Okay.
So whatever white thing you see there is the heart.
Okay.
So your lung by right should be black.
Right.
But the moment you see white thing in the lungs, can you see the white thing in the lungs?
Spotting. Right.
That's abnormal.
I see.
So we always said that God gave us 2 lungs to compare.
Okay.
So our lungs should be black in color. The moment they get all the white patches,
something is not
that
right.
means something is not correct.
Okay. Right.
So Stanley's X-ray, this is done in last year November.
Okay.
November 2014. So you can see the white patches over there.
Right.
That means this is due to an infection.
Right.
We don't know whether it's TB or not. How to confirm?
With the
phlegm.
I see.
Correct.
Okay.
So a woman doctor does a chest X-ray.
Right.
They find the X-ray is abnormal.
Right.
Then the doctor say, okay, buat kahak. They'll do a sputum check for them. And the phlegm will show that he has got a TB in the phlegm.
I see. Which means there's also in the lungs.
It's in the lungs.
Okay.
The phlegm comes from the lungs anyway.
Yeah, true.
So in the lungs.
Right. by looking at this,
Yeah, sure.
does that mean it's only affecting on the left side of the lungs,
Exactly.
not on
You
the
are
right
correct.
side?
You are correct.
Okay.
So it's very good. You can say that. You can see the right side a bit. You can see by right should be black like this,
Okay.
but you can see even the white patches there.
Okay.
But they are much less compared to the left side.
How bad, by looking at this, is
Okay.
this bad?
So this you can say is a moderate TB.
Okay.
Moderate means it's not. If they are affecting both left and right all over,
Right, and all
then
white
you can say
patches
it's
here.
white patches. You can say severe TB.
Okay.
I'll show another X-ray to you later.
Okay,
Another
sure.
patient.
Sure.
So
sure.
this is Stanley's X-ray before the treatment was given to him.
Right.
Okay, I think just for you to remember.
This is when you discovered
Yes,
that you had
correct.
TB.
Last year.
Yeah.
Last
Okay.
November, correct.
Right.
And just for you to remember that the white patches are more
on the
here
left?
on the left.
Right.
Let's compare with the X-ray now. This X-ray is done in
Taken.
9th of March.
Oh, recently.
9th of March, just
Very
about
recently.
3 days ago.
Okay.
Can you look at the white patches less or more?
It's more black now.
It's more black now.
Right.
So the white
Okay.
patches are disappearing.
Yes.
So that means his TB is going to be cured.
Right. And the medication works.
The medication works.
Right. Any questions, Stanley?
So now you're saying that it's the white spots is the
Getting
TB
less.
getting less.
Getting
Right.
Both sides or
Both sides. The right side is almost disappearing. Left side, there were a lot of white here, white there. Now you can only see here on top.
how much
Okay.
of improvement that?
I would say about 80% improvement.
Really? Do you feel any
Yes.
improvement? The way you
Yes.
breathe?
The way I breathe, I couldn't walk.
Really? You can't walk?
When he first came, he couldn't walk.
Really?
Yeah.
Yes.
Wow. So now how do you feel
I
after
can
the
run,
treatment?
I can play
Really?
football.
So by looking at this, how do you feel now?
I feel happy because
Right.
9th of March I went for the X-ray
Uh-huh.
and now I'm
You can
seeing
see.
this. But the doctor told me in the hospital that you're improving. You don't worry.
Right.
You're
But you
getting
didn't
better."
really see what's happening with your
That
X-ray.
that is what is this? Private, like sick. They are one. We
No.
cannot see
Right.
our medical report.
You don't show to your
No, we
patients?
do show. Sometimes
Okay.
we do show, but things again, sometimes the patient may not understand.
I see.
So it may be a bit
Right,
difficult.
right.
But we always tell them the X-ray is getting better.
Okay.
The other way to show that Sunny's TB is getting better is we will always check the phlegm regularly.
I see. How regular is
Yeah,
regular?
we will check the phlegm say every 1 or 2 months once.
Okay.
If Stanley is outpatient, so he comes to the clinic 2 months once.
Right.
If Stanley is in the inpatient, we
Uh-huh.
check the phlegm every week.
I see. So by looking at this, and
Okay.
after November, December, January, February, March, so that's 4 months.
4 months.
So by looking at this, how many months does it take for it to be out
Okay.
of the lungs?
I think, Swati, you are asking me a lot of good questions.
Okay.
Can I
Because
take
I
it
need
away?
to know all these things as well.
Can I take it away?
Yeah, sure, sure.
Okay. The thing is, the TB is a very funny germ.
Okay.
The TB germs grows very slow.
It grows very,
Very
slowly.
slow.
Okay.
So medically, if any germ grows very slow, they also die slow.
Okay.
They also die slow.
All right.
That's the basic mechanism about organisms and germs.
Right.
Like flu.
Okay.
If you have a flu, you get better within a week
Yes.
because the germs develop very,
Very fast.
and they
dies
also die very fast.
Okay.
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 So that's the reason why for TB, because they grow very slow, they will die very slow.
Right.
So and the other bad thing about these TB germs is that they go all over the body.
Right.
You can only see in the lungs nicely,
Right.
but they go all over the places,
The
small places here and
brain.
there, everything.
Right.
So sometimes they go and hide here, go and hide there, they go hide the bone, everything.
Right. Can
So-
they become dormant?
Yeah, they become dormant.
Okay.
That's the interesting thing about TB.
Okay.
So that's why we give them 4 antibiotics for TB.
Okay.
We give them isoniazid, pyrazinamide, ethambutol, and rifampicin.
Okay.
So these 4 antibiotics must be given together to kill the germs all over the body. And like what you correctly say, the dormant also.
Right.
They kill the active TB and the dormant TB.
Aha.
If you only kill the active TB by giving 2 antibiotics, dormant one will be there forever.
Yeah,
may
it
come
will
up again.
flare.
It will
Yeah.
flare again.
Dormant is
Dormant means they are living quietly in the body.
Right.
They are hiding somewhere in
They're
the body.
hiding and sleeping
other
in a way.
places.
Other places.
Right.
That's why you give them for long duration.
Right.
Oh.
If you don't take medicine regularly, Stanley, and you take only for a short while, the dormant thing will come again.
Right.
Then you get TB again.
Oh.
So TB can recur.
TB can recur. So that's why you must make sure that patient take medicine regularly, at least for 6 months.
Right.
So they must take 2 months of 4 antibiotics.
Mm-hmm.
The 4 antibiotics will kill the bacilli very fast.
Okay.
and even kill the
Dormant.
active one, the
active ones. Okay.
Then the 2 months again, you're going to kill the dormant ones.
Right.
The
But
4
can
months,
you get
sorry.
rid everything? But because I've heard some of them said you can't get rid every germs in
Cannot.
your body.
You can.
It will still be there.
You can say
and-
you can kill them 99.9%,
Right.
and then the rest, your body will take over.
Right.
That's
And they said the
correct.
possibility of recurring
Correct.
is very high as well.
Not
Is that
very
true?
high. Not very high.
Okay,
For
not
TB
very high.
recurrence, is less than 5%.
Less than 5%.
Less than 5%.
Okay.
But then again, suppose you get older, and then you got diabetes, you got immunocompromised, you get stress, and all other things.
Right.
Some
Stress
people,
can cause
they-
to flare up.
definitely, Yes.
Wow.
Definitely.
Okay.
When you are actually under stress, your immune system goes down.
Aha. So don't get stressed, yeah, Stanley. You're recovering right now.
It goes down. So they actually come up again.
Okay.
So, like what you say correctly, treatment for TB is for 6 months. And
Okay.
this is very important.
Okay.
I showed actually later to you about one patient who did not take medicine regularly. And he took medicine and he stopped. He took medicine and he stopped.
Once he feels better, then he stops.
They stop. That's the thing. Many people, when they feel better, they stop.
Obviously.
And this
Yeah.
person, I'll show the exit to you later, is that person again went and saw traditional medicine.
I see.
He did say again Santa and everything.
Right.
And I feel very sad.
Okay.
And I keep telling people that Malaysia has got one of the best healthcare systems in the country, in the world.
Right. But the mindset is not there.
The mindset is not there. This you can say is the culture, maybe is the way they are brought up, you know.
Right.
And their belief and everything. So we
Okay.
can't actually say anything about that.
Right.
But thing is, we got all the best healthcare system in the world. We should make use of it.
Right. And what do you think about the medicine that were given to you? Were they working effectively towards your body?
When first I was admitted,
He had to be admitted.
No, I think it's we do not admit all the patients with TB because
Okay.
TB can be treated as outpatients.
Yes.
But sometimes we got patients who are very ill.
Right. So
And some-
you're not
yeah. You can't even walk, yes,
right?
correct.
I
Yeah.
couldn't walk.
Couldn't
I
walk,
was breathing, like
Like asthmatic.
Yeah.
Okay.
I cannot do work or cannot walk so long.
Okay.
If I use my energy, I get
Tired easily.
not to say tired. I can't breathe.
Oh, okay.
And then Dato, he put me in the hospital. He asked me to take the medication. All
Right.
took my history. That's the one.
The first one. Yeah.
And then
How long were you there in the hospital?
after 2-3 days, I was walking.
Oh, okay.
No, I'm not lying. 2-3 days only I was walking.
Right.
Then the nurses give the medicine in the early morning, and then in the evening we just take our
Continuously.
medicine.
Okay.
That's the most important thing.
Right.
He told me also, the medication is what's gonna make you get better.
I see.
And then after 2 weeks, my phlegm was cleared negative.
Okay. Right.
That was fast, 2
Okay.
weeks only.
Right.
If
And you
you-
were suffering since 2011. Don't you wish that you you should have went to see the doctor earlier?
like Datuk said just now, at 2011 when I was coughing,
Right.
I thought it was heat,
And
cigarette.
smoking.
I didn't actually have the chest pain.
You don't.
I didn't.
And do they have chest pain
Not
usually?
necessarily. Chest pain is just one symptom of it.
Okay.
Like I say, most common thing is cough.
Coughing. Okay. So you were saying?
I think certainly very important point.
Right.
They say when you cough, prolonged cough, you must check for some infection.
Okay.
Normal cough will disappear within the most by 2 weeks.
Okay.
If anything goes more than 2 weeks, you must check your at least do an X-ray or check your phlegm.
Right. And some say, this is what I heard, I don't know, correct me if I'm wrong, they said once you have TB, it's easier for you to get other diseases as well. Is that true?
Like what do you mean?
Any other, because they said because your immune system is so low, fighting the germs, that other diseases also can infect you.
Not really. Not really.
Right.
Not really. It's the other way around.
Oh, okay.
It's the other way around. Suppose you got diabetes, and suppose you got say HIV, and suppose you're malnourished, suppose you're stressed, then you get TB.
I see.
No?
So not the other way around.
Not the other way around.
Okay. So you were saying that with the medication now you're a bit healthier.
I'm so much healthier. I
Right.
feel young. I can do a lot of things already.
Right. Have you started working?
No, I'm still in the hospital.
Right.
I'm taking my medication because you see, most of the patients, they leave the hospital, like Dato said, some of them come back
Right.
after 1 week. I also was in the hospital. I left I asked to be discharged. I went back home. I wasn't taking my medication properly.
Really? Okay.
It's like doctor say lah. It's a human kind of behavior. Some people they
because they feel better. Right?
No, they are very they care for their health.
Okay.
Okay, so they care for their health, they take their medicine.
Right.
Right. But I thought I was better already.
Okay, so you stopped taking your medication?
No, my medicine finished. He gave me a date. The hospital people gives a date, you know, like 1 week or 2 weeks to come back for your medication and to check you up. So I didn't go.
Right.
And then I became worse.
Really?
Yes, that was when
So you had to be admitted again.
So these are the old story that Sunny is telling. So these are story that happened 2011.
Right.
So he took a medicine intermittently.
So
Intermittently.
it got worse until 2014.
Yeah, correct. Then after that he stopped medication and it became worse. And then when he came and saw again last year, that's why I got to admit him to
the hospital.
To make him stronger and then also make sure that the treatment is continued in a regular way.
I see. Okay, we have to go for another short break, and when we come back, we'll talk more on TV right here on Hello Malaysia.
Terima kasih. Sama-sama. Terima kasih. Sama-sama. Sama-sama. Terima kasih. Sama-sama. Sama-sama.
Satu cerita, satu bangsa, satu Malaysia.
And welcome back to Hello Malaysia. We are talking about tuberculosis with Dr. Abdul Razak and also a patient of TB, Stanley. And before we went for a break, we were looking at Stanley's X-ray and how it has recovered or from TB. Not say recovered, recovering.
It is recovering.
From
it's
TB.
80% much better.
Right, better X-ray.
Better X-ray.
For the last few days that was taken last few days. But you have another patient that you really want to show the effect of TB towards the lungs.
Exactly.
Yeah.
Yeah, this patient is a very sad case. It's a very young patient.
Okay.
A very young patient. Again, I can show the X-ray. This was done in 2011.
Okay.
Okay. And again, like I said just now, Suryati.
Yes.
Anything black is normal.
Right.
The moment you see a white patch, it's TB.
Okay.
Or it's an infection, you can say. It's infection. Until you check the phlegm, you can say it's TB.
You know, okay, for sure.
So this patient actually had TB, and you can see it's very mild. It's only a small portion of the lungs.
Okay.
Okay. And again, very sad, he did not take his medicine regularly. And they have a strong belief in the Santau and Botan Orang and traditional medications.
Okay.
So he defaulted our medication and went over to the traditional medications.
Right.
And he came in very ill. So
Right.
this is done
So
in
this is
November.
2011.
2011.
Mm-hmm.
So, and this X-ray is 2012. Can you see it's getting more?
It's spreading.
Yes.
Oh, okay. For not taking your medication
taking
regularly.
medications.
Oh, he stopped taking
He stopped
medication.
medication.
Okay.
He came again in 2012 January.
Right.
Then 2011.
Yes.
So, and after that, what happened?
Mm-hmm.
You can see the X-ray is progressing. This X-ray is done in the latest X-ray.
Mm-hmm.
You can see this X-ray is done in 2012 again, by February. You can see the white patch.
It's getting
worse.
larger. Yeah.
This is a simple thing what happened to a person.
It's like a white thing over
It's a
here.
white
There's
thing
no
over there. That means
black.
the whole of the left lung is damaged.
Infected.
Infected.
Do you call this damage or infected?
It says infected.
Okay.
Very good. I'll show the damage later.
Okay.
Okay, it's infected.
This
Right.
can
Sorry.
happen, excuse me, Dato.
Yeah.
This is happening because he's not taking his
Not taking medicine.
Right.
It's so fast.
So
it
bad.
spreads. If you stop,
Yes.
And it's true, it's fast because the before X-ray was only in January, and this is what,
correct.
February?
February, yes, correct.
And you had the whole left lung
Correct, true.
infected by the germ?
Yes.
like me, even 1 week I didn't never take the medicine.
You started coughing?
Started coughing and couldn't walk. Was very weak. My legs shaking.
I see. Okay.
So fast, never take the
Correct.
medication.
So
Right.
it's
So
a setting.
it should be a reminder to you.
Yeah, true.
Right.
And I hope this X-ray can be reminded to many people in Malaysia and that taking medication for TB is very, very important.
Very important.
And you should be consistent with the medication.
Right.
Every day.
I think it's, you know why, when we get sick, let's say a flu, when
Correct.
doctor give you antibiotics, I can tell you 9 out of 10 people will not finish their
You're very true.
antibiotics.
You're very true.
Right.
They
I
will
think
not-
I'm guilty.
yes.
I'm part of that. I'm guilty as well.
I'm also the same patient. Yeah,
Okay. So they think it's the same thing by
Exactly,
taking
yes,
this,
true.
but it's not true.
But we do counseling, no, Suryati. We do counseling for every patient with TB that they should take it for 6 months.
Okay.
We do counselling
Continuously.
yes, we do
Yes.
counseling for every patient with TB.
Right.
The moment a doctor in my clinic sees a patient with TB,
Right.
and then they are confirmed with TB and they give a medication, they will all go to my nurses where they give counseling.
I see. Why do you need counseling?
Because TB is a chronic disease.
Okay.
And we must tell them that how they get TB and what are TB symptoms, what are the things you must do.
Right.
And again, TB medications got some side effects.
I see.
That is very important.
Is it mild?
Some of them can be mild, some of them can be severe.
Right.
This is where patients sometimes stop treatment.
Aha.
Suppose they take medicine for TB, they feel like
Sleepy?
macam ngandung ni, macam mual ni, macam nak muntah ni,
Okay.
pening kepala, you know.
Right.
So this is one common side effect.
Do you have that when you took the medication?
I had itchiness.
Okay.
Okay, then they give me a medicine.
To stop the itchiness.
Yes, and then I felt numbness in my leg.
Correct.
Right.
Correct.
And then they
Very
gave
good.
me vitamin pills.
Correct.
Right.
So that
And
is a good thing.
now I can, it's normal already.
Right. So if you have side effect from the medication that you were
Yeah.
given, so you would be given another medication to
No,
stop whatever
the thing
effect.
is, it all depends, Sudhati. If the side effects are very mild, like what Stanley says, we give them something to prevent the itchiness.
I see.
Or give them some lotion.
Right.
But if the itchiness is very severe, affecting the whole body, we will stop the medication. We will stop, like I said, there are 4 antibiotics.
Yes.
We know out of the 4, 1 of them may not be good.
I see.
We will stop that one culprit.
Right. But would that be as effective as having all 4?
It may be less effective, but still okay.
Okay.
So 3 antibiotics are still considered okay.
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 So let's see the last
Correct. So
X-ray.
if you can see that this is progressing.
Yes.
And
Very rapidly.
this is in the 2012.
Yeah.
And he defaulted a few times.
I
Defaulted
see.
means did not come a few times.
I see.
And he came in last year very ill. And this is our latest X-ray.
March. This is March.
March.
Okay.
Can you see this whole thing is black?
Yes.
That means the black can be due to a lung or can be just due to be air.
Right. As you mentioned.
Yeah.
Yeah.
So he only got the air there, but no lung tissue. That means the whole left lung is
it's
completely
just black.
just black. And that air is not going to your body.
Oh. Okay.
It just remains there.
Right.
We call them a bulle. The medical term is called a bulle, macam balloon.
I see.
Dia macam dah rosak paru-paru. And dalam usaha apa tu, like a balloon, the air just stays there. It doesn't go to your body.
So are you saying that the left lung is
gone,
damaged?
completely gone.
Completely gone.
The black one.
Black one. It's completely gone.
What? Okay.
So now he's only having the right
Relying
lung.
on the right lung.
Right lung, and he's using oxygen every day.
Okay.
And he's a young patient.
Really?
So can you imagine his future?
Yeah.
It is very sad.
Right.
It really is very sad because this should not happen.
Should not happen.
Shouldn't happen. If we can comply the treatment, take the medicine regularly, it should not happen at all.
You're very lucky that
Yeah,
even though you stopped your medication,
Correct.
it didn't go this bad.
Stanley is lucky. You're very lucky.
Yeah, because I came to the hospital, when I couldn't walk, I came to the hospital.
Right.
And I saw a doctor, and he told me the importance
of
taking the
continually
medicine.
taking the doctor.
When he heard I wasn't taking my medicine properly, he was very sad.
Okay.
He told me it's very wrong.
Right.
You're going to spoil your health.
Okay. And talking about medicine, is it okay for me to ask? Is it expensive?
Can I tell you something?
Right.
It's 100% free.
I see.
TB treatment in Malaysia, Suriati, is 100% free.
Right.
You don't pay a single cent.
So there's no reason for you not to take
You don't pay a
it.
single cent for admission.
Right.
You don't pay a single cent for the x-rays and blood tests and anything you do for investigations.
I see.
It's completely free.
Wow.
It's completely free.
Right. And that should not be a reason for you not to take it.
Yes, correct.
Right.
But again, human nature, when you give free, people don't want.
Yeah. They might question it. Why are they giving us free medication?
We're giving it free because we want to control the infection.
I see.
We don't want others to get it.
Okay.
And coming back to the point you mentioned is now about what's going to happen to other people around your family.
Right. How about people taking care of the TB patients?
So before that, I must go to the family.
Okay.
Like I said, TB is a very interesting disease. No? It's not like anything like pneumonia. You see a doctor, he gives you antibiotic, you go back, you take antibiotic, you feel better. Finish, it goes there.
Okay.
But TB, I can't do the same thing. Because TB is a disease which is chronic. And you must make sure you take medicine every day regularly, that's two. And third thing is that, because like I said, TB is infectious, it can spread to anybody near you in your house.
Right.
So that's why we call that contact tracing.
Okay.
Contact tracing means we will do tracing for everybody who is staying with you in your house.
And taking care of you. Okay.
In your house.
Right.
Your father, your mother, your sister, your children, your wife and everybody. So they will call them to come and check for TB. So this is one thing we do especially for TB, not for other disease.
I see. And they get for free as well?
Free as well, correct.
Okay.
You don't pay a single cent.
Okay.
You don't pay a single cent.
Right.
So we do contact tracing for everybody in the house or everybody in the working place or everybody in the school or university.
Right.
As long as there's a close contact with them.
I see. So basically, I mean, let's say I'm taking care of a TB patient. What should I be aware or what should I do to prevent
you
all
can
this?
ask Stanley, most of my doctors do rounds in the ward, we wear a mask.
Okay. So does the family they have to wear masks?
The thing is,
as well?
family thing is a different thing in the sense that many a time a patient come and see a doctor after coughing for months.
Okay.
Okay. Logically speaking, if you cough for months, you already spread it in your house already.
Everybody.
It doesn't make sense.
Right,
you know what I mean? It doesn't make sense.
Okay.
It doesn't make sense. So they already exposed before they come and see me for diagnosis.
Right.
So in that sense, it doesn't make sense. But we do advise the patient that if you cough, try to put a handkerchief or put a tissue.
Right.
And don't spit anywhere in the environment.
Don't spit.
Don't spit.
Okay.
This is what they call cough etiquette.
They give us a container sealed one. You spit in the
So you spit in the container and you
you
throw away
cannot
the
spit
container?
in the rubbish,
That's correct.
or on the sink.
You can't do that because
They
it will
always-
spread.
It has spread.
the air.
Because, like I
In the
said,
air.
you evaporate to the environment.
Okay.
You know?
So you were given the container?
Yes, correct.
So you throw away with the container after that or you wash it after that or
No,
something
if
like that?
they want to check means they'll take the container.
Ah.
Then if
As a
they,
specimen? Okay.
Specimen, yes, correct.
if it's just for spitting, we throw it away.
Yes, right.
So how do you? You spit it in the container and then you throw
And then
it
there's
away.
a basket. What do you call that?
The yellow one, that's the biohazard.
Biohazard.
So we got a special dustbin, we call a biohazard dustbin.
Right.
So anything that's infectious, we
You
put
throw
them
it
in the
inside.
yellow basket.
But do you give them to bring back home? No.
No.
It's only in the hospital.
In the hospital, yes, correct.
Okay.
See, like me, from 2011, my wife and my child went to check up, and thank God nothing happened to them.
They're negative.
Negative.
Right.
Now even though my speed is negative,
right, but you're still aware of it.
I'm still careful.
Right.
Like my wife or the doctors and nurses come in, I'll always wear a mask.
Would the caretaker have to take medicine as well, just in case?
Not really. The thing is, we will check the caretaker.
Okay.
If the caretaker will only do an X-ray. If we do X-ray, we also do another test called TB mental test, skin test they call.
Okay.
So if the both are negative, you don't have to take a medicine.
You don't have to.
You don't have to.
Okay. Right. Okay, we have to go for another short break, and when we come back, we'll talk more on this matter right here on Hello Malaysia.
I travel not because I like to travel. I travel so I can say this. What you're looking for is inside of you, and you should be in peace.
Prem Rawat has been traveling for 40 years, inspiring people around the world to find peace within.
I go and I talk to people, and I present them with the possibility of themselves discover the peace that lies within you.
Catch Bernama Today every weekday from 9 a.m. onwards for the latest news, lifestyle stories, interesting personalities, only on Bernama TV.
Dibelenggu kebankrapan semuanya bukan pilihan. Saya pernah cuba dibantu, namun saya tidak hiraukannya kerana saya merasakan MDI akan bertindak kejam terhadap saya. Sehinggalah kebankrapan mula mengganggu hidup saya. Saya hilang punca untuk meneruskan kehidupan. Akaun saya dibekukan. Apa nasib keluarga saya? Selama ini saya menyangka MDI zalim yang membangkrapkan saya. Ternyata sangkaan saya meleset sama sekali.
Jabatan Insolvensi Malaysia, bukan kami yang membangkrapkan anda. Jangan takut atau risau untuk tampil ke depan. Berilah kerjasama agar kami dapat membantu anda. Layari www.insolvency.gov.my.
And welcome back to Hello Malaysia, and today we're talking about tuberculosis with Dr. Abdul Razak and Stanley. Now, Doctor he wants to bring up this matter because a few days ago he was reading something on the newspaper about tuberculosis or TB, and he was a bit upset because according to him, the figures and the content is basically untrue. So probably, Doctor, you can mention about this.
Just to highlight, there are two paper cutting I actually have with me. One is from Cosmo.
Right.
This came out on the 9th of March. And the other one is just today, 12th of March.
Okay.
Star newspaper. The one that say the Cosmo is that pekerja asing punca penyakit TB.
Right. Okay. You can hold it up.
Yeah, correct.
Right.
So this is very sad in the sense that the message they want to put there actually is wrong.
Okay.
In the sense that they are blaming everything for the foreigners. The figures are correct, but it is a wrong figure in the sense that what they say is that they put down there about say 70,000 cases of TB in this and that in kalangan asing.
Okay.
70,000 cases, which I think is wrong.
That's a big number.
It's a big number. That means it is more than 3/4 of what you see in Malaysia.
I see.
Last year in Malaysia, we had 25,000 new TB cases.
Okay.
This 70,000, that means more than half are in the foreigners.
Right.
Which is very frightening.
I see.
And which I think is not true.
And they're pointing fingers to the foreigners.
Correct.
Okay.
It's not, although they do contribute TB to the country, yes, but not to this amount of numbers.
I see.
So what I think the paper is quoting is that there's a thing called FOMEMA. FOMEMA examines all foreign workers to come to work in Malaysia for any field.
Right, they have to go for screening.
Yeah, they go for screening. So when they go and do X-ray for these patients, the X-ray will show the white patch I mentioned just now. So that white patch, they will say that is abnormal.
Okay.
So the moment it's considered abnormal,
they're not allowed
they
to
will
work
reject
in
the
Malaysia.
whole thing.
Okay.
So those are the figures that come with the 17,000.
I see.
So that white patch doesn't mean all is TB.
I see. It can be any other diseases
It can
as
be any
well.
other disease or can even be old TB.
Right.
Sometimes when you have TB, like Sandy, when you got TB right now, the scars can be there for life.
Right. You call that scars?
Yes, the scars.
Okay.
The scars for TB infection in the lung can be there for life.
Really?
Yes, it remain white for life.
Okay.
But the phlegm will not have TB germs.
I see.
That's why you can say that the scar is there, your phlegm is negative, so you don't have TB now. It's just the old TB.
I see.
Correct. So I think the 17,000 is actually, if you ask me, is abnormal chest X-ray, but they're not actually active TB. Yes, correct.
Right.
In a way, they are correct because they can actually reactivate in the future.
Right.
But it
it's
doesn't
not
mean
an active.
It's not active TB.
I see.
To say that they have active TB, I think if you ask me, it actually is wrong.
Okay.
It's not sure. And the same thing is also mentioned in today's Star paper. They mentioned same thing. TB is 17,000 in 1981. Hepatitis B is 4,000 and syphilis is 1,000. Everything. These are infectious diseases. So just to correct in the sense that over the past few years, the foreign workers contribute only about 15% or the most 20%
of the number of people affected
TB
by
infection
TB
in Malaysia.
Okay. Only
it is number is correct.
Okay.
It is we can say 1/5 the number.
Right.
But the 80% are still Malaysians.
I see.
You know?
Right. So by putting
Malaysians.
this on the paper, it's like telling that the foreigners are bringing in TB.
Correct, yes, true.
Okay, which is
they are
untrue.
bringing in, yes, but not this number.
Not this number.
That's the number.
Okay.
That's the number.
Right. Okay, now let's talk
sure.
about the World Tuberculosis Day, which is, we can say celebrated every year on the 24th of March.
I think the word celebration is a good word to use.
Really?
It is a good word to use.
Okay.
You know why? Because that's the only day that we tell about TB all over the world.
Okay.
TB was first, even I think, remember I was telling about Santau and everything?
Yes.
Even 100 years ago, people still TB is Santau.
Okay.
Even in the Western.
Black magic.
Yeah, black magic, correct. Until 1882, Robert Koch.
Yes.
He is the one who found the TB baseline.
Yeah.
March 24th.
Right.
That's why every year March 24th is the World TB Day.
Right. It's the way to celebrate that
Correct.
he discovered.
To let people aware that TB is still there.
Right.
TB is curable and TB can be treatable.
Right.
And the theme for this year is that get the 3 million.
Right. 3 million means?
That means what they say is that there are 9 million people with TB. That's what
9
million people with TB.
Around the world?
Around the world.
Okay.
And we are missing 3 million.
3 million?
Yes, correct. We're missing 3 million either because we do not catch them, or they don't come and see us.
I see.
You know?
They'll think they're having something else.
They're having something else.
Okay.
They don't come and see a doctor.
And I know it's also called reach, treat, cure everyone.
Correct. The thing is, we want to reach these 3 million people. And we want to diagnose them and treat them.
I see.
If you do not treat them right now, they keep on spreading.
Yeah.
So there will not be a stop for TB.
Right.
There will not be a stop for TB. And it's very sad. TB is 100% curable and it should not actually just going on.
Oh, if they are out there, you can spread to so many
people. Yes, you do not treat them effectively, they will spread.
Right, obviously.
Yeah, that's true, no?
Right, okay, so we are almost to the end of the program,
sure.
and I would like to give the floor to Dr. and also Stanley, maybe, advice or to wish them or something like that.
Maybe I leave it to Stanley
We'll start
first.
with Stanley first.
Stanley, yes.
What would you like to tell people about tuberculosis? Or advise them?
TB is actually a very serious, dangerous disease, So we have to take the medication. We have to go for treatment. We have to see the doctor. We have to go for counseling. Counseling is very important. Okay, every morning the doctors in IPR, they come and speak to us and tell us, things like this. And I can tell you that I feel much more younger.
Right.
And
healthier.
I'm very grateful to Dato and his staffs. Like Dato, Dr. Tinesh, Dr. Jasmine. They're very good.
They were there.
They care for us. Because they know TB is like Dato said, it can spread, very fast to other people, our family members. Would you like to risk that? I mean, your wife, your
and
kids,
children,
Right. So if anyone out there has a cough,
has been going on for 2 weeks, 3 weeks, or more than that.
Take it serious. Like when I went to GH and I came to the IPR, they straight away X-ray me, took my phlegm and took my blood, and they straight away test. And they confirmed like that I got TB, and then I was worried already. My wife, my kids, things like that, lah.
So get a quick and fast examination if you think that you're
that's the most important thing. And for the TB patient also, they must take their medication.
Right, strictly.
Yes.
Right.
Very good point. Very well said.
Okay, thank you, Stanley.
Very well said. I think I really appreciate Stanley for coming here to tell his experience. And we want every patient outside there watching us also to see that TB is curable.
Right.
And TB patient should not die.
Right.
And it's good to get them to come and see us earlier and get things diagnosed very much early. And once again, the World TB Day, Sureti, I must thank you and also Bernama for calling me here to educate people in the public about TB.
Right.
I must thank you very much.
Thank you so much, Doctor, and thank you, Stanley, for being with us and educate us about tuberculosis. And thank you so much for tuning in to Hello Malaysia. And until we meet again real soon, I'm Sureti Sanusi. Goodbye.